So for our disease, we have aortic stenosis. But before we go into that, we need to talk a little bit about how the heart works normally. So after blood is coming back from the body, it's deoxygenated and it enters through the inferior and superior vena cava into the right atrium, which is going to be shown below. After blood enters the right atrium, it's going to go through the tricuspid valve into the right ventricle. And from the right ventricle, it's going to go into the pulmonary valve, which is shown there, into the pulmonary artery, which is going to go to the lungs. And the blood that's going there is going to be reoxygenated and brought back to the heart via the pulmonary valve, which is shown right there. And from the pulmonary valve, it's going to go into the left atrium, and then from the left atrium into the bicuspid valve into the left ventricle. And from there, it's going to go into the aortic valve, which is shown below. The aortic valve has three flaps and allows blood to go into the aorta and to the body. Now, if you see here, the three valves allow the right amount of blood to pass through and keeps blood from, backflowing into, where it came from, which could cause complications. Now, in aortic stenosis, you have the problem with the aortic valve. The aortic valve is too small. And what this means is when the valve is too small, it's not able to allow enough blood through. And because not enough blood is going through, not enough of the reoxygenated blood is going to go to the body. And now we're going to talk about the causes. So the causes for this is, the first one is a birth defect, which causes the aortic valve to, two of the flaps to be fused together. And this, as you can see in the photo here, does not allow enough blood to flow through. And not enough blood flowing through and not enough oxygenated blood flowing through means that the body does not get enough oxygen, which it needs. And for the second cause is just through aging. When you age, certain mineral deposits and calcium buildups or scarring can cause the valve to become stiffer, and this also sort of minimizes the valve and allows less of blood flow to go through. And that's about all that we have to say about aortic stenosis. Thank you for listening, and that is all.